And you could also say just secondary to Alzheimer's disease, because isn't that a symptom of Alzheimer's?
Dementia.
Okay. And
what are the signs and symptoms? What is it manifested by?
weight loss.
Her weight loss.
Right, that's the most
And one of the
important. She's
things-
lost 9 pounds.
And her lack of general interest in eating.
And lack of general interest in eating.
Okay. So, you're her nurse. You have this patient. What are you going to do? What are going to be your interventions for this patient?
Well, for one thing, I would assess her and just see on a daily basis, you know, what her mood is. Try. Another thing we could probably do is make sure we weigh her every day.
Okay, so to see what her progression is going to be? Okay. Terrence?
I think we should monitor her intake and try to work her up to eating at least 50% of the tray by 3:15.
Okay, so you think monitoring her intake and a good goal for her would be patient will?
Long-term goal would be the patient would meet nutritional high requirements, either short-term.
Okay, that's a good long-term goal. But what about a short-term goal? Anybody else?
Patient will eat at least 50% of per meal.
Of each meal? Okay, what do you want to give her? About a week? Because it needs to be measurable, it needs to be smart.
By a week.
About a week? Okay. So, let's move on to
Some interventions.
well, we have a little bit of daily weights. We're going to monitor her intake. What else are we going to do for that Alzheimer's patient to prompt her to eat?
Cue her. And we're going to offer
what she
Yeah,
likes.
keep it clean, make sure her room's clean and neat
Clean.
and appetizing.
maybe offer more
Roommate's
food
got
more
it.
times a day.
Okay, frequent meals.
And also snacks in between would be good.
Okay, and you said
Find out what she likes to eat.
her preferences.
Her interest would be good.
Yeah, good.
Okay, that the patient is clean on top of, and the room is clean. What else promotes a good taste in the mouth? Oral hygiene. Okay. So do you think by using these nursing interventions that we could help with this nursing diagnosis? Because we can't teach her to eat because she's got the dementia, but we can sure make sure that she eats. We can be with her, we can cue her, we can remind her of eating, find out what she likes to eat, make sure it tastes good. Sound like we're going to take care of this patient will meet this goal? Okay. So, what other issues do we have with her?
Well, she seems to be very depressed, you know. Sometimes she does have dementia, but there are times when she is somewhat conscious, and it's got to be really hard going from your home, you know, and coming into a facility like this and leaving her family.
So what would be a good nursing diagnosis for that?
I'd say if there's a family which would thrive, and it's related to depression.
Okay. And it's manifested by?
It's manifested by loss of appetite.
She verbalizes it a lot also.
Okay, so
what does she
not
say?
happy.
She misses her family. She misses her home. It's hard for her adjusting. And I think with this disease, unlike a lot of others, from what we were seeing when her family came, it's just as hard on the family. You know, it's heartbreaking. Unlike a lot of the other diseases and illnesses, this is one where you have to slowly watch the person deteriorate right before your eyes. And unlike maybe something like cancer, it's not an actual, it's not one of the more common diseases where you see that person struggle and digress.
Okay, so how are we going to take care of her failure to thrive? Can't teach her to eat, so how are we going to deal with her failure to thrive and her depression? What are some nursing interventions that we can do for that?
The things around her in the room that make her feel comfortable, maybe a television show or pictures of her family or books that she likes.
Okay, so
Very
like
good.
family
Things
items.
that remind her of home, you know, and
Okay.
make her surroundings.
Find out what she likes to do. Like if she likes to do arts and crafts, get her to the craft.
Get her involved in activities.
Okay. So
We can also talk maybe with her family to see if we can get a schedule.
involve the
as far
family.
as- Yes, and teaching them about the disease.
See if she likes science fiction books.
She won't remember the scary ending.
How about just providing company to her, just being there with her? That is, I think, one of the most important things with these dementia patients is just having the companionship and having people with them. Makes them feel more comfortable and less scared and fearful of what's next, since a lot of times they don't realize even where they are.
Just having them there.
Yes,
Even silence is therapeutic, right?
that's right.
Okay, so a good short-term goal would be patient maybe verbalizes a feeling of happiness, of feeling of well-being, or maybe she feels a little safe. You know, she's now adjusting to her environment. Since we're providing company, we're involving her in activities. You know, we're involving the family in her day-to-day care. We're involving them in, you know, the reminders of home and everything else like that. Okay? Now, there's a lot we can do with drugs. Meaning they're moderate to severe Alzheimer's. They're progressing. What are some drugs that maybe you researched when you came and you got your report on this patient coming in today?
Well, our patient right now is on the Exelon patch, I believe.
Correct.
And it seems to be working for her, but we also did a little research on our own, and we found some other drugs that they're using for dementia as well as Alzheimer's too.
Okay, let's start with the Exelon patch. What does the Exelon patch do?
The Exelon patch, it inhibits the acetylcholine, and the acetylcholinesterase, the enzyme,
Okay.
and it's specifically in the brain because that's what the problem is with dementia.
Okay.
Is that a patch? That's a patch, you said?
This is a patch.
Okay.
And how long is your client going to wear that? Is it something you're going to change out a couple times a day, or
She just wears one
one?
each day, and it is changed out. And when you're on this medication, it's very important that you monitor the weight, which is what we'll be doing. And there are some symptoms with nausea, vomiting, and diarrhea, so that could have an effect. But so far, it doesn't look like she's exhibiting or showing any.
Okay, so if your patient has nausea, vomiting, diarrhea, what are some of the things we're going to look for with the patient who's exhibiting those symptoms?
Dehydration.
Okay, so fluid and electrolytes. Okay, so bringing back to the balanced nutrition is really going to help with that.
It can also increase her confusion.
Right.
And speaking of which, as you mentioned, with one of the tests that they performed when she was first admitted here was the urinalysis and the CBC, just to make sure that maybe it wasn't something that was physiological, that was, making her disoriented.
Okay. And,
UTI.
yep, urinary tract infections can cause confusion. What are some of the other drugs that you guys researched?
Aricept is a popular drug that's used for dementia as well as Alzheimer's. And but obviously we wouldn't have to worry about pregnancy with our patient because it is a contraindication. She's not on NSAIDs and she doesn't have cardiovascular disease, so that may be something we want to look at too.
The more natural item or drug that can be used is ginkgo biloba, which is an herbal supplement. It has many uses, including cerebral insufficiency, dementia, of course, and also circulatory disorders.
Okay, so we've got, there's some stuff out there. Things seem to obviously be progressing in the drug market as long as we keep learning more about dementia and Alzheimer's. You mentioned CBC and a urinalysis for patients before they start the drug to rule out anything prior other than dementia. For your client, was she getting any frequent labs or anything other than the CBC in UA?
She did, or she was. They did give her, they did do an assessment. There are some other tests that can be done with dementia. As you mentioned in lecture, Nurse Rivers, the time clock test, the drawing, which is something that she had to determine that she did actually have dementia. Some other tests that they do are the mini mental status exam, which is something that's a little more common, and it's basically where they give you 30 questions and you have to answer them within a certain period of time. And they're pretty simple questions, but just as you pointed out and told us earlier, when you're disoriented like that, the most common things or things that we should know, such as the day, are very hard. And in that test, that's something.
Okay, so being aware of, it's what she's aware to herself and not necessarily to the date, time, place, and things like that.
Right.
Which all coincides. Very good research. Does anybody have any questions? So you all felt comfortable with your garden patients today, ready to tackle them again tomorrow and improve your care? Okay. That's our presentation on dementia, and
Nope, that's it.
and balanced nutrition.